tag teaming. We are now going to our not in conference items on the health list, and there are two. We'll start with the first, which is the California Endowment Grant for Medi-Cal Renewal Assistance Payments. Department of Finance.
Yes, this item is a reopen, or is a not in conference item that would we would provide a zero general fund for this at this time, given that we're already making significant investments in local county welfare offices, as well as the exchange.
Seems like a kind of sad to be saying no to funds offered to us from the California Endowment, but we realize there's other general fund pressures. So, Senator Hancock.
I'm sorry, but I do have to ask, because in the old days of previous administrations, there was a lot of difficulty around issues of making it difficult for people to enroll, and people then sort of being pushed off the rolls to save the state money. Now, this is basically a grant that the California Endowment wants to give us, which my understanding is will pull down 100% federal match. Is that the case?
That's not quite correct, Adam. There is a non-federal share, and it's a 50-50 match. And the idea, though, is that the non-federal share would be provided by the endowment as opposed to the state.
Okay. So, in other words, no money from the state would go into this. It would be federal money and California endowment money. And then the only cost to the general fund would be that people who are currently enrolled in Medi-Cal, with the help of a similar grant last year, would be re-enrolled. And so any savings come from people not being re-enrolled. Isn't that sort of against the whole idea of the ACA, which was to enroll people in Medi-Cal so they could have medical services?
And I think that we have had a very good policy in the state, which is the no wrong door policy, and we have significant investments at both the state health exchange as well as the county, the entire county welfare offices structure across the state. That is our infrastructure for renewals, and so we think this is just a duplication of efforts.
Then why are you saying that there will be a general fund cost if we do it?
So the proposal would be to pay enrollment counselors to enroll people into the Medi-Cal program and to help usher in their renewals. While we try to make sure, and the counties try to make sure that everyone is re-enrolled in the program who is eligible, not everyone fills out the form and does their renewal. And so we made an assumption based on the amount of dollars that were offered that there would be some number of additional people who would not decide to re-enroll in the program without that assistance.
Well, I'd like the record to just show that this was an administration request, not something that emanated from either house of the legislature.
Senator Leno.
Thank you. I share the sentiments of Senator Hancock, and I recognize that this is a compromise proposal. But could you get a little bit more specific? You've made it seem like the re-enrollment is just simple as filling out a form. Is it that simple indeed, especially for the population we're talking about, this vulnerable population? Do they have to bring some documentation? What do they have to provide? How do they know what to provide? How onerous is this? They have to take a day off from work. What does it all mean?
So certainly with healthcare reform, the vision is that renewals in the Medi-Cal program will become a much simpler process. And I think that the administration has made every effort to ensure that people don't fall off the program who may be eligible. We've experienced some hiccups with some of our new IT systems and that sort of thing, and I think that we've erred on the side of making sure that people remain enrolled in the program. The vision for the future is that there will be efficiencies with the federal data hub. There will be less paperwork. People will remain on the program at much higher rates than they did prior to implementation of federal health care reform. And that is a response to some of the concerns that have been raised here about paper-based processes that can result in people coming off the program who might otherwise be eligible.
So, I'll let this be in just a minute, but I want to get some further clarity. So without the assistance of the certified enrollment counselors, do you have an estimate as to how many folks will not be enrolled?
I don't have the number of cases with me, but certainly we do make an assumption on that, and we can provide that information very easily.
I have a note that it might be 3,600 individuals.
I would trust that number, yes.
So I think what you're hearing from us is that as we approve this, to the degree that you can, without the assistance of the counselors, reduce that number significantly, you would have our encouragement and support.
Was that a question?
Rhetorical at best. It was a request.
Of course, what I'm sitting here thinking is whether there's any kind of compromise to the compromise, but we'll see if there's a motion on the item.
I'll move the compromise.
All right, we have the motion right now on this action to on the trailer bill, but not on the acceptance of the grant. That's in effect what we're acting, correct? Did I get that correct? We have language on a trailer bill, but we would not be accepting the, no, it's no language. It's no. Okay, nothing. Okay, apologies. Thanks for clarifying. I was reading the little explanation that's all written in hyperscript wrong. So we'll take a vote on that.
May I
Senator
be clear,
Nielsen?
the motion to the $0, is that the motion?
Correct, 0, yes. All right, so on the Senate side, that's a 4, and on the Assembly side, that's also a 4. All right, the last not in conference item is the specialty drug rebate for